Hi everyone, I'm Sriteja and today I'm here with Dr. Pooja Goel and we're going to be learning about what she does as a doctor and basically about her specialty.
Thank you, Sriteja. First of all, thanks for having me over. I'm so looking forward to it. Hi everyone, I'm Dr. Pooja Goel. I'm a dentist by trade, and what exactly I do? As I said, I'm a dentist by trade, and I'm also an expert in dental sleep medicine and dental craniofacial pain. Part of my job is to analyze the oral health of the patients, also help them in the disease prevention. I also do some corrective surgeries such as crown surgeries like implants, removing the teeth, patients who have difficulty sleeping in the night time and they've tried all the other treatment modalities. We help them make some devices so they can sleep better, and also with some sort of headaches and pain, which are residual headaches and pain, and people can take care of it by getting all the medicines and everything. They get referred to us for taking care of it. So it's a multi-specialty practice, a multi-specialty part of the work where we take care of their oral health, any problems related to the face and the mouth of the patients.
Wow, that's really interesting.
Yep.
So Dr. Goel, why did you choose medicine as your career path, and is there any story behind it?
Absolutely. Very funny story and kind of very emotional too. Sriteja, how we say that you always remember a feeling and you never forget about a feeling. Mm-hmm. Long story short, when I was into my third grade, my parents were building up their career and they decided to make me leave me with my grandparents for about a few years while they were working on their career. So from grade 3 to 4 years after that, I stayed with my grandparents. So they were actually my parents at that time. My grandmother, she was significantly older than my mother. She had brittle diabetes. All her ailments did not stop her from giving me 150% of her love and attention. Back when I was living with them, when we had parents-teachers meeting, and they would invite my grandparents to come in. And when they went with me, on one of the meetings, I especially remember that a kid was making fun of my grandmother and he couldn't stop laughing because she was a little overweight. Also, she had a few problems with her teeth. At that time, because I was in third grade, I don't remember what disease she had. But I do remember that feeling of humiliation and embarrassment, what she had on her face. It was written all over her face. She tried hiding it, but I could see it. As I mentioned, that feeling, which was it was like a strange feeling, which was, I could feel in the pit of my stomach, and I've never forgotten about it. When I was in my 8th grade, I remember that I lost her. At that time, I knew 100% that what I wanted to do, I really wanted to change that outcome for her. Since then, if anybody walks into my practice, have the same set of circumstances, I make sure that I improve it for them, and that's pretty much is for her. That's the reason I became a dentist. A lot of my, when I look back into my early age, when I was a teenage, I also remember my dad telling me that he would like me to be a doctor, and he always believed into having a life-work balance. And he always mentioned that he loved people, how they did the dentistry and have a balanced life. They don't have to go in the middle of the night to do certain hospital calls and everything. So it's a combination of many factors. My grandmother, my father, I said, why not? Let's just go ahead and take up on that. So more the years go by, more I enjoy it. I love it, what I do.
Mm-hmm. So you also talked a little bit about what inspired you to do dentistry. Correct. As well. Yes. But is there anything about dentistry that inspires you to this day?
Oh, absolutely. As I mentioned to you, that more the years pass, more I enjoy it. Dentistry is very rewarding. I don't even know where I can start talking about it. It gives you an opportunity to serve patients. The feeling of gratitude and appreciation on the patients, what you see is very rewarding. As I said, it's incredible feeling, gives you a feeling of joy and fulfillment. Particularly about dentistry, if you look at all the other specialties, people are sick and not feeling healthy and they go to the doctors. they get evaluated, they get medicines to take, and they are recommended to do certain tests and the surgeries. Sometimes it doesn't work out. It's not the instant gratification. They don't feel good right away. Being dentists, I have done certain procedures throughout in the last 20 years of my career that where I can see the rewards are like so amazing. You can make a day and night of difference to the patients. When you restore their smile, they are just completely full of joy. So, the way you are skilled with your hands, the way you're able to get the results you want, the way you make patients happy, instant gratification, fulfillment, joy, rewarding, it's like you impact their personal, their professional life. They will basically transform their lives, and that's what I like about dentistry. And I think that's what was inspiring enough for me to get into this part of the medical field.
Those are all such inspiring stories from you, Dr. Goel. So is there anything else that's like really rewarding about your job, or like what you do specifically?
Off late, as I mentioned, not only dentistry for me is just not about taking care of the teeth anymore. Additionally, empowering dentists and the dentist team, I'm very passionate about. In the last few years, I came across a lot of dentists in my profession who were having low self-confidence and low self-worth, and it changed the whole dynamics of their team and the patient care and the practice overall. I've been helping them to understand how they can kind of basically instilling the self-belief, strong self-belief, so they can change certain things in their practice and get going and change the whole dynamics of the team. So as I mentioned earlier, not only the dental part where I'm able to do certain things for them to feel medically better, take care of their oral health, help them prevent certain disease, do some surgeries, but also a part of it is changing how the people actually go and do the work. So impacting their personal and the professional life is what is driving my passion for the dentistry.
Wow. So guys, Dr. Goel is not only helping her patients, but she's also empowering other doctors and the field of dentistry as a whole. So I congratulate you, Dr.
Thank you.
And yeah, that's actually really interesting about the field of dentistry. I didn't know that before.
Yeah.
So now that we've talked about like all the rewarding things about dentistry, is there any challenge or any roadblocks that you face whenever you encounter your job? Or
Sriteja, my humble hope for this discussion we are having right now is to make sure that you get to know what goes behind the stage. I also want to inspire you and give you the insight about what goes behind the dentistry. But the challenges, I don't want to I don't want you to be disappointed hearing some of them. There are challenges in everything. When I wanted to be a dentist, getting the education was also a tough part of it. All the dental schools are very expensive. Once you get through the education part of it, expensive schools, you have to spend hours and a lot of intense amount of time into doing those clinical rotations and doing the internships and etc. Then comes setting up the practice part, which is also very, very difficult. Unpredictability. You don't know what your day is going to go like, and you're challenging patients. You can't make everyone happy. There are going to be diagnoses which are not able to fully support with the clinical literature you have. You won't be able to make everyone happy. So there are challenges everywhere. As you know, being a healthcare professional, it's a high responsibility job, and high responsibility comes with a lot of stress. Being on call, always not having a mental day off. These are all challenges. And off late after COVID, the whole world, the whole universe is suffering with a shortage of staff. So having a well-designed, curated staff coupled with empathy is so difficult to get. So these are the challenges I find. But other than that, it's pretty cool, very balanced work-life balance kind of profession. Once you're out of the college and you're able to set up a practice, as I keep mentioning that more the years go by, more you enjoy it. I've never looked back, and I absolutely enjoy every aspect of it.
Mm-hmm. Yeah, that's really insightful. Thank you, Dr. Goel.
You're welcome.
So for anyone who wants to pursue dentistry or medicine as a whole, do you have any pieces of advice that you could give them?
My piece of advice is not just about dentistry. It's pretty much, if you want to take up on any career, don't just make it as a business exercise. Always find what matters the most to you, thinking what you really want out of your life. And if you change the way you think about what you want in your life, you'll excel in every part of the career. Speaking of dentistry, I would say If this is your calling and you love being hands-on with patients, you love hands being with certain procedures, you are going to get the opportunity to do a lot of hands-on work. It's something which you are able to get instant gratification with. AI, and there's so many other platforms you can take the support from. Dentistry is a career to go for. Once again, you are done between 9 to 5 of the job, you come back, you have the whole day, rest of the day, and the night to yourself. You don't get too many calls in the nighttime. And if you end up choosing any other specialty into the dental field, such as craniofacial pain or let's say sleep medicine, you are able to collaborate with so many other doctors on board. Absolutely rewarding job, you know.
Mm-hmm. Yeah, that's really insightful, Dr. Goel. So now in the news, like people are talking about the rise of artificial intelligence.
Correct.
And how they're taking over jobs, and they're also taking over some jobs in the medicine sector. So would you like to say anything regarding like the capabilities of AI or its ability to take over potentially like a dentist job, or do you have anything to say about that?
So, you know, I really appreciate this question coming from you, because I know all the youth is all about AI nowadays, you know. That being said, I absolutely don't feel that AI can ever replace a doctor's or a dentist or a medical doctor's job, ever. The kind of AI is related to all the machines and everything. You know, the doctors have a lot of empathy, they have heart, they have skill that cannot be taken away by any AI technology. However, have you read this book by Dr. Shial Diniz? He talks about the psychology of persuasion. Have you ever heard about it? Okay, you must read that book. It's a great read. You know, it talks about the principle of authority. So if you look at AI, I believe it taps right into Dr. Shial Diniz's psychology of authority of principle. When patients come to seek any help from you, you are a person, you're a doctor to them. You give your opinion, they might like it or they might not like it. They might think that it's the opinion of a doctor. Now, when AI comes into the picture, it's like an objective platform that's able to tell the person what the consequences are going to be, how they should take care of their health. And coming from an objective expert like AI technology, it really, really helps the patients to accept the treatment, accept the diagnosis, and actually go with it. So I really, I'm huge into AI. We have a lot of technology in the office. You should come and see it sometime. I don't depend completely onto AI, but it has made the job so much easier. It helps the patients to understand what the problem they have. And I definitely don't think they can ever replace the doctors or the dentists. Having AI side by side to you, it's a very powerful tool. And we're absolutely thrilled about all the guys who are working into field of computer science and this research and AI to come up with the newest technology. I have quite a few in my office, and I've absolutely thrilled about working with them.
Yeah, that's really interesting actually, because whenever I come across this question, like I feel like people who are afraid of AI taking their jobs, they say, oh, AI can never take our job, AI can never do this. But it's really interesting to see as a doctor's perspective how not only you are welcoming to AI and technology in your practice, but you also accept that it's like a rising industry. Oh, yes. And even though it could never replace a doctor, it can still help you tremendously in your practice.
Absolutely. It's just the way a physician feels. It's, as I mentioned earlier in our discussion, that it's your calling. You know, I've not known yet a doctor who became a doctor for the heck of it. It goes in a lot of hard work, goes in a lot of love and empathy for the patients, and that can never be replaced by a machine. But AI is a very strong, powerful tool, and I absolutely look forward to, and every time there is something going on in the rest of the world, any conventions or any new models, I always go check them out. It's amazing how well they have done.
So Dr. Goel, you mentioned you use like some technology and machinery in your office. So do you want to explain what type of technology that you use in the office?
Absolutely. You know, there's something which I'm really very excited about having in my office. It's a CBCT machine. What it does is, you know how you're talking about AI, right? There's so many technologies and so many instruments and so many equipments you get. But nothing was as close as getting something where you can see through what's going on in the bone. So if I were to tell you about the machine, what I have, it can scan, it can give you a huge scan of the whole face, and you can tell within like 10 seconds as the picture pops up, you can see how much of the bone you have in the patient's mouth. You can see how much gum they have in the mouth, what exactly is going on inside, which you cannot tell by the help of the x-rays, which have been there for a longest time. So I'm really a huge fan of that. It has helped me over years to diagnose so many problems in a matter of no time. Also to get the good prognosis, get the good outcome of the procedures. That really helps me. When you are under promising and over delivering, it's basically striving to exceed the patient's expectations. Patients are always very happy. With the help of tools like CBCT machine, you're able to pinpoint the problem, get the solutions, and get that going. So I really love it. There's another thing in my office. I'd love for you to come and check it out. It's a laser. You know how you guys play the laser tags, all the guys. So when you do the surgeries with your hands and with all the mechanical instruments you have, you can get where you want to sometimes. But the machines like lasers, what we have in the office, it's just like playing the laser tag. You can go ahead and get the right instrument and point it on the tissues, and it'll take care of all the infections. So many tools in the office. I have many equipments in the office, many, like all the advanced technology. I really would love you to come and check it out one of these days, but I can go on and talk about it the entire day. I'm sure you're gonna get tired listening to it, but amazing. Yeah, super. That's the word I have for it.
Definitely will come and check all these really cool. You make them seem like they're like super cool.
Absolutely. You know, some of our patients say, "Doc, you love your toys, right?" and I do tell them, yes, I do, because it just makes your life simpler, as we talked about it. And when I tell the patients I'm going to do this surgery with the hands, they're never excited. But the moment you tell them that you have this laser and it's going to make it painless for them, much more effective for them, they jump right into it. That's what exactly I was talking. It's a principle of authority where they know it's going to work for them. And they're not hearing it from you. They're seeing it in front of them and they're hearing it from the internet. It works wonders.
Wow, that's super interesting.
Yes.
So right now we are in Dr. Pooja Goel's office, and let's learn about all the cool machinery that she has, starting with this one. So Dr. Goel, can you explain what this is and like what it does for a patient?
Absolutely. Welcome, first of all, Sriteja. This is a little place where we do all this magical stuff for our patients. Right now, you're standing in front of this, the newest technology, what we have in the office is called CBCT machine. What it does is, it's first of all, it's, as we know, the technology is changing every day and every industry is benefiting from it. But for us dentists, it's changed the way we work with patients. It helps us to kind of get better prognosis of the patients. We're able to do dentistry far more in a very efficient and in a better way with better predictability of outcome of the treatment. And this guy right here is super amazing when it comes to technology. It's called CBCT, as I mentioned earlier. You know how when we drive from place A to B, we always put our navigation on. You drove to my office today, you had your navigation on. It helps you to get to the right place in less amount of time, correct? Similarly, this machine can help me to look inside the bone and the gum in a very efficient, accurate, comprehensive, and the quickest possible way. As you can see this picture right here, it helps you to look at all the structures in the jaw. If I were to do any clinical procedures and I want to know what's exactly the density of the bone, and how good the bone is inside the scan of the teeth, I am able to tell with the help of this machine. So it makes my job so much more easier. It helps me to do better dentistry. It's painless. It's very efficient. It takes 150 to 200 images, all of that in few seconds. It compiles them together into a 3D scan in no time. And voila, the whole world is yours, and you can do implants, you can do corrective jaw surgeries, facial aesthetics, what you want to do with this, with the help of this tool right here.
Wow, that's really cool. Like before,
Yes.
what did you do like when this machine was invented?
You know, it's been out there in the United States of America since early 2000.
Oh,
There are so many centers across the board in the United States of America where you can send the patients and they get their scans done. I, of course, when I opened up the practice, it's a very expensive buy, and I took some time to buy it. And so I used to make the referrals to those centers where the patients will get all their CBCTs and MRIs. As you look very athletic to me, I'm sure you play some sports. And you know how when we get all sort of small injuries, we get sent to El Camino Hospital in Stanford to do those MRIs and CBCTs. So I used to send my patients to those locations to get that done. And then I felt I just cannot work. I had this time where they would send the scans back to me. I said, I'm going to invest into this technology, and it's the best thing I've done so far. I can't stop bragging about it. This is how much I love this.
So, Dr. Goel, what is this machine, and do you want to explain what it does?
Absolutely. Once again, I'll say that I love the technology in my office. A lot of patients who come here, they come here for this reason. They know we have the newest technology in the office. If I were to explain, this is called, by the way, water lace. I've had it for almost 10 years in my office. Absolutely love it. It makes the patient sit very, very comfortably in the chair. And why is so? Your amount of anesthesia you give it to the patients is a lot more less when you use a water laser. You know, what's the fear you have when you come to the dentist? Let me, Sriteja.
Like, they'll hurt my teeth
And the needles.
Yeah.
Correct. So this can replace the drills. So what happens is when you use this machine, you don't have to numb the patients. You can do those procedures in less amount of time, very comfortably without anesthesia. It replaces a drill, so that heat and vibration what you get from the drill is not there. So patient feels very, very comfortable. They're not intimidated by coming into the dental office. That's what I like about it. I'm sure you have been to a lot of those playgrounds, arcades and all that, where you have laser tags and all that. If I were to explain you as a layman, with the laser tag, you can get to those people which you're playing the laser game with from far away and in a very accurate manner. And exactly the same way, the water laser, it shoots with a different wavelength on one particular tissue and kills that bad bacteria in matter of no time, very precisely, very accurately, without any pain, without any drilling, without much of the anesthesia involved. So just about the laser tag, I love everything about it. I do tons of my gum surgeries with the help of this.
So there's like different options you can choose.
Yeah, you can actually, you can even extract the teeth with it, as a matter of fact. And I do a lot of perio means gum surgeries with it. So if you were to go for, let's say, gum procedure, if I were to explain you with the help of this screen right here, you can see that how the gums are there. If I were to clean underneath the gums really deep, I'm going to need a blade to cut the gums and flap them down and then clean underneath. But since I have this cool equipment right here, I can just charge up the laser, set the right wavelength, point it onto that particular part of the gum without cutting it with the blade and surgical blades and all that. I can go ahead and get to the deeper part of the gum, clean all of that up. And the best part is you can even stitch up the gums with the help of the laser bandage. So I can talk about it hours and hours all day long. It's so innovative. There's so many features you can do with this. You can do root canals with it, go into the deeper part of the nerve, clean it up really well. Patients don't have to come back again. If you go for any root canals, they have to go for one time to open the tooth, then to finish up the root canals. But with this guy right here, you can get it all done in no time.
Just with water.
Just with water. It's a water lace. And then this is restorative, means fillings. Like, you know how the kids, when they have the decay, they're so afraid of coming to the dentist because they're going to get the shots and everything. Here, you can do it without numbing the patients with so much of ease.
Wow.
So very, very, very effective tool. Patients love it. When they look us up, they know that we have water lace and they choose us for the convenience, for the comfort we're going to give it to them. So it's basically the comfort we provide to our patients with the help of these technologies.
So only select dentists have these, but not like lots of them?
I believe there are only 2 or 3 in this particular zip code who offers this technology. Even the CBCT, I think this one right here, the one I showed you earlier, is only in our office. It takes the maximum volume. It can take the whole scan in one go. And this can do so many things with the same thing. So we're a lot into lasers and technology.
Yeah, I didn't know like dentistry could have this much like advanced technology.
As we talked about, technology has a lot to offer, but we dentists have really gotten a lot out of it. So I cannot even think of working or doing any procedure without having the special equipment associated with it. That's how much we like the AI platform we talked about.
That's really interesting. Thank you so much, Dr. Goel, for showing me all these cool machinery.
Absolutely, my pleasure.
So, Dr. Goel, as a dentist, do you have any tips or tricks that you can talk about dental hygiene for kids or for adolescents?
Nowadays, as I mentioned, oral health is not just about brushing and flossing. It's a combination of many factors. It's what actually you eat during the day, how you brush your teeth, how you floss your teeth, what kind of food you eat. For instance, for kids, my advice would be to brush twice, to floss twice. Not only that, during the daytime, I see a lot of all these sugary drinks, boba, frappuccinos, cappuccinos, try to cut down on them. Have more watery vegetables such as celery, carrots, broccoli, apples, carrots. I do tell kids who are younger to their parents, and if kids are teenagers and high schoolers, just like you all, I emphasize a lot on healthy eating, brushing probably twice a day, and if it's too much, once a day, but flossing once a day is very, very important. And I know you're all so busy doing so many things. You guys are hands full, you have a plate full of stuff to do when you guys are in junior and sophomore year. But taking small tips towards eating right food and brushing and flossing twice, that's the only mantra to the good, successful, good oral health. Yeah, that's pretty much it.
Wow. That's it for today, guys. Thank you so much, Dr. Goel, for this amazing interview.
Absolutely.
You had such amazing stories, inspiring advice, and
Thank you,
just
Sriteja.
overall gave us such a nice introduction into the field of dentistry.
Thank you. My goal was here to just give you a basic blueprint, what goes behind the scenes. I really wanted to make sure that you're aware of and it can inspire you, give you the insight about the dentistry, and a lot more youth like you guys, and you guys can be can't wait to have you guys choose the medical field as a profession. Thank you.
I hope you guys learned something about dentistry as well, and feel free to comment down below what was your favorite thing that you learned today in this video. And as always, feel free to like, comment, and subscribe. And that's all for today. Thank you so much, Dr. Goel.
You're welcome. Thank you so much.
Bye.